Welcome to the Optimal Life Project After Dark series. Tonight, you're experiencing 100 gentle truths about sleep, designed to calm your mind and invite rest. There's nothing you need to do, nowhere you need to go. Your body has been preparing for this moment since you took your first breath. This isn't about trying harder or doing more. It's about discovering the quiet wisdom that lives in your cells, waiting patiently as you settle into stillness. Over the next hour, we'll journey through the landscape of your sleeping body, not to control it, but to witness it, not to force anything, but to recognize what's already unfolding. Every word is a gentle reminder that you are held, that your body knows its work, and that sleep isn't something to chase. It's something to welcome. Let's begin. The architecture of sleep. Your sleep unfolds in stages, each serving a distinct purpose in restoration. 4 phases cycle through the night: light sleep, deeper sleep, profound rest, and finally, the dreaming state. This journey repeats 4 to 6 times, each cycle lasting 90 to 120 minutes, a rhythm written into your design. Stage 1 is a gentle transition, lasting 1 to 5 minutes. Your eyes close, muscles relax, brain waves slow from busy daytime patterns. Alpha waves give way to theta waves, moving at 4 to 7 cycles per second. Your brain is powering down, dimming the lights for deeper rest. You might experience hypnic jerks during this stage, sudden muscle twitches that sometimes wake you with a falling sensation. Completely normal. Scientists believe these may occur as muscles relax and the nervous system transitions to sleep, though the exact mechanism is still being studied. One theory suggests the brain might briefly interpret this relaxation as falling, causing muscles to contract. Stage 2 represents deeper rest. Body temperature drops, heart rate slows, breathing becomes regular. This stage makes up 45 to 55% of your sleep, roughly 3.5 hours in an 8-hour night. During stage 2, your brain produces sleep spindles, brief bursts of rapid activity at 11 to 16 cycles per second. Research suggests these patterns may help protect sleep by filtering external stimuli. Studies also indicate they could play a role in memory consolidation, though scientists are still working to understand exactly how this process unfolds. K-complexes also appear in stage 2, sharp, high-amplitude brain waves. Research suggests these may help suppress cortical arousal and keep you asleep, potentially serving as a bridge between sleep and wakefulness. When you hear a dog barking but don't wake, this could be one of these protective mechanisms at work. Stage 3 is where the deepest restoration occurs. Also called slow wave or delta sleep, your brain produces large, powerful delta waves at 0.5 to 2 cycles per second. Your arousal threshold is highest here. If awakened from stage 3, you'll feel groggy and disoriented for several minutes. Deep sleep dominates the first half of your night. During your first cycle, you might spend 20 to 40 minutes in stage 3. As the night progresses, these periods shorten, giving way to longer REM sleep. Your body knows exactly when it needs profound physical restoration. Adults spend 10 to 25% of sleep in stage 3. In 8 hours, that's 48 minutes to 2 hours of deep sleep. This varies by person and age. Children spend up to 40% in deep sleep, supporting their rapid growth. Your muscles are fully relaxed during deep sleep. Pulse slows to its lowest rate. Breathing becomes slow and rhythmic. Blood pressure drops. Your body takes a deep breath after the day's demands, allowing every system to rest and repair at the cellular level. During deep sleep, your pituitary gland releases growth hormone, essential for tissue repair, muscle growth, and bone strengthening. In children, it helps them grow taller. In adults, it repairs damaged tissues, builds lean muscle, and strengthens bones. Most secretion happens in the first few hours of sleep. Your immune system becomes particularly active during deep sleep, producing cytokines that target infection and inflammation. This is why adequate sleep is crucial when fighting illness. Your immune system relies on deep sleep to mount effective defenses. Deep sleep is essential for the brain's waste removal system, the glymphatic system. During deep sleep, the space between brain cells expands significantly, allowing cerebrospinal fluid to flow more freely and flush out metabolic waste, including beta-amyloid proteins. Associated with Alzheimer's disease, your brain literally cleans itself while you sleep. Memory consolidation happens robustly during deep sleep. Your hippocampus communicates with your neocortex, transforming short-term memories into lasting ones. Facts learned, skills practiced, faces seen, all being filed away and strengthened during these periods. Research suggests deep sleep may contribute to insightful thinking and creativity. Problems you've struggled with sometimes become clearer after good sleep. During these periods, your brain appears to reorganize information and make new connections between concepts, which could lead to creative insights and fresh perspectives on challenges. Your body's metabolic rate is lowest during deep sleep. This reduced energy expenditure allows more resources for repair and restoration. Cells rebuild, tissues heal, your body prepares for another day. This energy conservation is why poor sleep can lead to weight gain over time. Body temperature reduction during deep sleep appears to be important for quality sleep. Core temperature drops by about 0.5 degree to 1 degree Celsius, with the lowest point typically in early morning hours. Research indicates this cooling helps facilitate metabolic slowdown and supports restorative processes. If deprived of deep sleep, even with the same hours in bed, you'll still feel tired. Sleep quality matters as much as quantity. Your body tries to make up lost deep sleep on subsequent nights, a phenomenon called sleep debt, ensuring you get needed restoration. Deep sleep is when your body performs its most intensive physical maintenance. Tissue repair, immune system fortification, hormone regulation, metabolic processes, all optimized during these profound rest periods. This is restorative sleep at its finest. The combination of reduced metabolic activity, lowered body temperature, growth hormone release, and immune activation during deep sleep creates the perfect environment for physical restoration. Your body is remarkably efficient, orchestrating multiple healing processes simultaneously while you rest peacefully. The world of REM sleep. REM stands for rapid eye movement, named for the quick darting movements your eyes make behind closed eyelids. Your first REM period begins about 90 minutes after falling asleep, lasting only 10 minutes. As night progresses, REM periods grow longer, with the final period sometimes lasting an hour. During REM sleep, brain activity becomes remarkably similar to waking. Fast, low-amplitude waves closely resemble waking brain activity. This is why it's called paradoxical sleep. Your brain is highly active, almost as if awake, yet your body remains deeply asleep. REM sleep makes up 20 to 25% of total sleep in adulthood. In 8 hours, that's 90 minutes to 2 hours, distributed across 4 to 6 separate periods. Newborns spend 50% in REM, decreasing to adult levels by age 3. One distinctive REM feature is muscle atonia, temporary paralysis of voluntary muscles except your diaphragm and eye muscles. Signals inhibit movement, effectively disconnecting brain motor commands from muscles. Researchers believe this protective mechanism prevents physically acting out dreams, keeping you safe while your mind wanders through vivid dream scenarios. The muscle paralysis is so complete that if sitting when REM began, you'd slump over. Neck muscles can't hold your head upright. Limbs lie still. Only breathing muscles and tiny eye muscles remain active. Remarkable biological engineering. This selective paralysis protecting you while essential functions continue. Dreaming occurs most frequently and vividly during REM, though dreams can happen in other stages. REM dreams tend to be more bizarre, emotionally intense, and story-like. Current research suggests your brain may be synthesizing memories, emotions, and neural activity into these narrative experiences. Though exactly why we dream and what purpose it serves remains an active area of scientific inquiry. During REM, heart rate and breathing become variable and irregular, speeding during exciting dream content, slowing during calmer periods. This contrasts with the steady rhythmic breathing of deep sleep. Blood pressure also rises during REM, approaching waking levels. Body temperature regulation changes during REM. You lose some ability to regulate temperature through shivering or sweating. Room temperature becomes especially important for quality REM sleep. Too hot or cold disrupts REM as your body struggles to maintain comfort without usual regulatory mechanisms. Research suggests REM sleep may play a role in emotional regulation. Studies show that during REM sleep, your brain processes emotional experiences while stress hormones like cortisol are suppressed. This appears to allow your brain to work through emotional memories in a calmer neurochemical environment, which could help reduce the emotional intensity of difficult experiences. Many people report waking with a clearer, calmer perspective on yesterday's troubles. Research suggests REM sleep appears to be particularly important for certain types of learning, especially procedural tasks involving motor sequences like playing instruments, typing, or riding bicycles. While deep sleep seems to help more with declarative memory of facts and events, studies indicate REM may play a role in consolidating procedural memories, though both types of sleep appear to contribute to learning in complex ways. During REM, your brain's visual centers show high activity, which may help explain the vivid imagery in dreams. Meanwhile, studies suggest your prefrontal cortex, the area responsible for logical thinking and reality testing, shows reduced activity compared to waking. This pattern could explain why dreams often seem perfectly logical while you're experiencing them, even though they're bizarre when recalled after waking. Neurotransmitter activity changes dramatically during REM. Acetylcholine levels are high, supporting vivid mental activity. Meanwhile, serotonin, norepinephrine, and histamine drop significantly. This unique neurochemical environment is important for memory processing and emotional regulation. If you wake during REM, you're much more likely to remember dreams vividly. Waking from other stages, you might not recall any dreams. This is why dream recall often happens in the morning. Your final REM period before waking is typically longest, giving the best chance to remember. REM deprivation significantly affects mood and cognitive function. People deprived specifically of REM become more irritable, have difficulty concentrating, and may experience increased anxiety. Your brain compensates through REM rebound, entering REM more quickly and spending more time in it during subsequent sleep. Certain medications suppress REM sleep. Many antidepressants, some blood pressure medications, and alcohol all reduce REM time. This is why people taking these substances may feel sleep isn't as refreshing despite adequate hours. Sleep architecture has been altered. Alcohol has particularly interesting effects. While helping you fall asleep faster initially, Alcohol suppresses REM during the first half of the night. As your body metabolizes alcohol later, there's often REM rebound, leading to vivid, disturbing dreams or nightmares. This is why alcohol-facilitated sleep is generally less restorative. The rapid eye movements aren't random. Some researchers have proposed they may be related to visual dream imagery, though this remains an active area of study. The theory suggests that when eyes dart left, you might be looking left in your dream scene, as if watching your dream movie unfold with eyes tracking the action even though closed. During REM, especially in later cycles, your brain appears to consolidate and integrate memories from recent experiences, connecting new information with existing knowledge and finding patterns. Research suggests this process could be important for creativity and problem-solving. Many scientists and artists have reported having breakthrough insights in dreams or immediately upon waking from REM-rich sleep. Though the exact mechanisms behind these creative connections are still being explored, research shows specific neurons active during learning become reactivated during REM. Your brain replays experiences, strengthening neural pathways associated with those memories. This isn't conscious. You're not actively trying to remember. Your sleeping brain does this work automatically, behind the scenes. The unique combination of high brain activity and muscle paralysis serves multiple purposes. It allows intense mental processing while keeping your body safe and still. It enables emotional regulation without physical stress responses. It facilitates memory consolidation without interference from physical activity. Remarkable biological balance. The dance of sleep cycles. Your sleep doesn't progress linearly, then stop. You cycle through stages repeatedly in sleep cycles. Each begins with stage 1, progresses to stage 2, then 3, briefly returns to 2, and culminates in REM before starting again. This circular pattern repeats 4 to 6 times during a typical night. The first cycle is usually shortest, lasting 70 to 100 minutes. As night progresses, cycles lengthen to 90 to 120 minutes. By your 4th or 5th cycle, you spend much more time in REM and less in deep sleep compared to your first cycle. Sleep stage distribution changes dramatically across the night. During the first third, deep sleep dominates with majority of physical restoration. During the middle third, more time in stage 2 with moderate REM. In the final third before waking, REM becomes predominant while deep sleep virtually disappears. This shift reflects different restoration priorities. Your body prioritizes physical repair and immune function early when deep sleep is abundant. Later, as REM dominates, your brain focuses on emotional processing, memory consolidation, and neural reorganization. Both restoration types are essential. Sleep timing matters almost as much as duration. Going to bed earlier typically results in more deep sleep overall because it's concentrated in first hours after falling asleep. Going to bed later might give more REM but less deep sleep. Your body follows predictable patterns. Sleep cycles are regulated by two main processes. Process S, the sleep homeostat, tracks how long you've been awake and builds sleep pressure throughout the day. Process C, your circadian rhythm, is your 24-hour internal clock promoting sleepiness at night and alertness during day. These interact to determine when you feel sleepy and naturally wake. Your circadian rhythm is controlled by the suprachiasmatic nucleus in your hypothalamus. This master clock receives direct input from your eyes about light exposure. Morning sunlight signals it's time to be awake and alert. Darkness signals it's time to prepare for sleep. Light is the most powerful influence on your sleep-wake cycle. The suprachiasmatic nucleus coordinates circadian rhythms throughout your entire body. Nearly every cell contains clock genes following a roughly 24-hour cycle. Your liver, heart, kidneys, all have internal clocks synchronized by your master brain clock. This is why jet lag affects not just sleep, but digestion, mood, and overall well-being. Melatonin is the hormone of darkness, released by your pineal gland in response to darkness. It doesn't directly cause sleep, but signals to your body that it's nighttime and helps promote conditions conducive to sleep. Levels begin rising 2 to 3 hours before habitual bedtime, peak at midnight, then decline toward morning. Light exposure, especially blue light, can suppress melatonin production. Core body temperature follows a circadian rhythm closely linked to sleep-wake cycles. Temperature starts dropping in evening, reaches its lowest point in early morning around 4 or 5 o'clock, then begins rising before you wake. This evening temperature drop is one of your body's signals that it's time to sleep. Morning rise helps promote waking and alertness. Cortisol, often called the stress hormone, also follows circadian patterns. Levels are lowest around midnight and begin rising in early morning, peaking shortly after waking. This cortisol awakening response helps energize you for the day. In evening, cortisol declines, facilitating transition to sleep. Disruption from chronic stress or irregular schedules affects both sleep quality and daytime energy. During deep sleep, particularly in the first half of night, your parasympathetic nervous system increases activity. This is your rest and digest system, promoting relaxation, slowing heart rate, and supporting restorative processes. Meanwhile, your sympathetic fight or flight system is relatively quiet. This neurological shift creates perfect environment for physical restoration. REM sleep involves more sympathetic nervous system activation than deep sleep. This is why heart rate and breathing become variable during REM. Your body is in high brain activity with more autonomic nervous system fluctuation, even though you remain asleep. This changing activation pattern across stages shows how your nervous system orchestrates different restoration types. Some people naturally have longer sleep cycles than others. While average is 90 to 120 minutes, some cycle through in as little as 80 minutes, others take up to 140 minutes. This variation is part of normal individual differences in sleep architecture, part of your unique biological makeup. Sleep cycles can be disrupted by many factors including stress, illness, medications, alcohol, noise, light, and uncomfortable conditions. When disrupted, you might not spend adequate time in each stage, leaving you unrefreshed even with enough hours in bed. Protecting your sleep environment and managing stress helps maintain healthy architecture. As you cycle through stages, brainwaves tell the story. Fast, irregular waves during REM indicate high mental activity. Large, slow delta waves during deep sleep show profound rest and restoration. Bursts of sleep spindles in stage 2 mark active memory processing. Each pattern reflects different brain activity, serving different purposes in nightly restoration. You typically don't remember transitions between stages or brief awakenings occurring several times each night. These micro-awakenings, lasting only seconds, are completely normal and don't indicate poor sleep. Your conscious mind doesn't register them. You might have 20 or more during the night without any awareness. The longest wakefulness period typically occurs in the last third of sleep, as REM periods become longer and more intense. Some people naturally wake briefly after long REM periods before falling back for another cycle. If you tend to wake at the same time nightly, say around 3 or 4 a.m., this might simply be the natural wake point between your 4th and 5th cycles. Your body has innate wisdom about sleep cycles. Even without an alarm, most people wake naturally at the end of a cycle rather than in the middle. This is why you might wake just minutes before your alarm, or can sometimes will yourself to wake at a specific time. Your brain tracks where you are in cycles and can time awakening at natural transition points. Understanding your sleep cycles helps you work with your biology rather than against it. If you need to wake at a specific time, calculate backwards in 90-minute increments to find optimal bedtimes. Waking at cycle completion feels more refreshing than waking mid-cycle from deep sleep. Your body appreciates being awakened at natural stopping points. Sleep across the lifespan. Sleep needs and patterns change dramatically across your lifetime. Newborns sleep 16 to 18 hours per day, distributed evenly across day and night. Their cycles are much shorter, lasting 50 to 60 minutes. Newborns enter sleep through REM rather than NREM like adults, and spend roughly 50% of sleep in REM. During the first 3 months, a baby's circadian rhythm is still developing. This is why newborns don't have clear day-night patterns. Around 2 to 3 months, circadian rhythms begin emerging. Babies start sleeping longer periods at night and staying awake more during day. By 6 months, most have clear circadian patterns with longest sleep at night. Infants and young children require significantly more deep sleep than adults. A 6-month-old might spend up to 40% in deep sleep stages. This abundance supports rapid physical growth, brain development, and immune system maturation. Growth hormone released during deep sleep literally helps them grow bigger and stronger. By age 1, most children sleep 11 to 14 hours per day, including 1 or 2 naps. By 3 to 5, most have dropped to 1 nap or none, sleeping 10 to 13 hours at night. School-age children gradually decrease, but still need 9 to 12 hours nightly, more than most adults. Teenagers experience significant circadian rhythm shifts, sometimes called delayed sleep phase. Their bodies naturally want to stay up later and sleep in later compared to childhood or adulthood. This isn't laziness or rebellion. It's biological design. The circadian shift delays melatonin release by about 2 hours, making it genuinely difficult for teenagers to fall asleep before 11 p.m. Despite shifted circadian rhythms, teenagers still need 8 to 10 hours nightly for optimal health and academic performance. Early school start times often conflict with teenage biology, forcing many to wake before completing adequate cycles. This chronic deprivation has been linked to mood disorders, poor academic performance, and increased risk-taking. Deep sleep amount peaks in childhood and early adolescence, then gradually declines throughout adulthood. A child might spend 25 to 40% in deep sleep, while young adults spend 15 to 25%. By age 60, deep sleep may account for only 5 to 10% of total sleep, with some older adults getting very little. This decline doesn't necessarily mean older adults need less sleep, though patterns change. Older adults often have more fragmented sleep with more nighttime awakenings. They may spend more time in lighter stages and less in deep sleep. Sleep efficiency, the percentage of time in bed actually sleeping, typically decreases with age. Changes in deep sleep with aging are linked to structural brain changes. The medial prefrontal cortex, involved in generating slow wave. Sleep tends to deteriorate with age. This deterioration reduces the brain's ability to produce large, slow delta waves characteristic of deep sleep. The result is lighter, more fragmented sleep. Despite getting less deep sleep, older adults still benefit enormously from prioritizing sleep. Good sleep hygiene, consistent schedules, morning light exposure, and managing health conditions that disrupt sleep can help maximize quality at any age. While architecture changes with aging, restorative value remains essential throughout life. Sleep disorders become more common with advancing age. Sleep apnea, restless leg syndrome, periodic limb movement disorder, and insomnia all increase in prevalence. Additionally, many chronic conditions becoming more common with age, like arthritis, heart disease, and depression, can negatively affect sleep. Treating underlying conditions often improves sleep. Many medications commonly prescribed to older adults can affect sleep architecture. Beta blockers, corticosteroids, and some Parkinson's medications can disrupt sleep. Conversely, some medications like certain antidepressants and antihistamines may cause drowsiness and alter patterns. Important to work with healthcare providers to manage medications supporting rather than hindering good sleep. The relationship between sleep and health becomes especially important in older adulthood. Poor sleep is associated with increased risk of cognitive decline, cardiovascular disease, metabolic problems, and decreased immune function. However, good sleep can be protective. Older adults maintaining healthy sleep patterns often experience better physical health, sharper cognitive function, and improved quality of life. Napping patterns change across the lifespan. Infants and toddlers need regular naps for healthy development. Most children outgrow napping by age 5. Adults generally don't need regular naps if getting adequate nighttime sleep. However, in older adulthood, short afternoon naps may return as nighttime sleep becomes more fragmented. A brief nap of 20 to 30 minutes can boost alertness without interfering with nighttime sleep. Your chronotype, whether you're naturally a morning or evening person, is partly determined by genes and partly by age. Young children tend to be morning types, naturally waking early. In adolescence, there's a shift toward evening chronotype. This gradually shifts back toward morning through adulthood. By older age, many find themselves naturally waking earlier than in middle age. Pregnancy can significantly affect sleep architecture and quality. In the first trimester, increased progesterone often leads to increased sleepiness and more sleep overall. In the second trimester, sleep often improves. In the third trimester, physical discomfort, frequent urination, and hormonal changes can severely disrupt sleep. After birth, sleep is fragmented by newborn care needs, though quality gradually improves over first months postpartum. Menopause can also disrupt sleep architecture in women. Declining estrogen levels are associated with increased fragmentation, more nighttime awakenings, and sometimes insomnia. Hot flashes and night sweats can wake women multiple times nightly. Despite these changes, maintaining good sleep hygiene and addressing menopause symptoms can help preserve quality during this transition. Throughout all life stages, consistency in sleep timing appears to be one of the most important factors for maintaining healthy sleep. Going to bed and waking at relatively consistent times helps keep circadian rhythm stable. This consistency supports better quality, regardless of age. Your body thrives on predictability in sleep-wake patterns. REM sleep amount also changes across the lifespan, though not as dramatically as deep sleep. Newborns spend about 50% in REM. This decreases to 20 to 25% by age 3 and remains relatively stable through adulthood. Even in older age, REM as a percentage of total sleep remains fairly consistent, though total sleep time may decrease. Understanding how sleep needs change across life helps you have realistic expectations and make appropriate adjustments. The 8-hour recommendation is an average for adults, but individual needs vary. Some function well on 7 hours, others need 9. Children and teenagers need more. Older adults might need less total sleep, but benefit from consistent schedules. Listen to your body's signals and honor individual sleep needs at each life stage. The immune connection. Your immune system and sleep are intimately connected in a bidirectional relationship. Sleep supports immune function, helping defend against infections and recover from illness. Conversely, when sick, your immune system can alter sleep, typically increasing deep sleep duration to facilitate healing. This interaction has been recognized for thousands of years in the simple wisdom that rest helps recovery. During sleep, particularly deep sleep, your body produces and releases cytokines. These are small proteins serving as messengers in your immune system. Some are pro-inflammatory, fighting infection and injury. Others are anti-inflammatory, helping resolve inflammation once threats are addressed. Sleep helps maintain delicate balance between these different immune signals. One cytokine particularly relevant to sleep is interleukin-1 or IL-1. This cytokine increases during sleep and actually promotes sleep itself, creating a helpful feedback loop. When fighting infection, IL-1 levels rise even higher, which is why you feel so sleepy when sick. Your body uses sleepiness as a tool to ensure rest while your immune system works. T cells are white blood cells, crucial for adaptive immunity, your body's learned response to specific pathogens. During sleep, T cells undergo important changes, enhancing their ability to recognize and respond to threats. Research shows sleep improves T cell ability to attach to and eliminate virus-infected cells. Sleep deprivation conversely impairs T cell function. Natural killer cells, or NK cells, are another crucial immune component. These cells can directly attack tumor cells and virus-infected cells without prior exposure. Studies show that restricting sleep to just 4 hours for one night reduced NK cell activity to about 72% of normal levels. This reduced activity returns to normal after adequate sleep, but chronic deprivation can keep NK function suppressed. The relationship between sleep and immunity is reflected in vaccine responses. Multiple studies show sleep-deprived people produce fewer antibodies in response to vaccines. In one study, people sleeping less than 6 hours nightly in the week after receiving hepatitis B vaccine produced less than half the antibodies of people sleeping more than 7 hours. Sleep affects not just immune cells, but also the environment where they develop. Your bone marrow is where blood cells, including immune cells, are produced through hematopoiesis. Research shows consistent adequate sleep supports normal hematopoiesis, helping ensure your body produces the right types and numbers of immune cells. Deprivation can alter this process, potentially affecting immunity long-term. During sleep, your lymph nodes, part of your immune system, show increased activity. Sleep appears to facilitate movement of T cells out of bloodstream into lymph nodes, where they can more effectively interact with antigen-presenting cells. This interaction is crucial for developing targeted immune responses to specific pathogens. When you have an acute infection, your sleep architecture changes in predictable ways. You tend to spend more time in deep sleep, which researchers believe may free up energy for mounting fever responses and supporting immune function. Meanwhile, REM sleep is often suppressed during active infection. This pattern suggests your body prioritizes the sleep type that best supports fighting infection, though the exact mechanisms are still being studied. The hormonal environment during sleep supports immune function. Growth hormone, released during deep sleep, has immune-enhancing properties. Prolactin, another hormone elevated during sleep, also supports immunity. Meanwhile, cortisol, which can suppress immune responses, is at its lowest levels at night. This hormonal constellation creates an immune-supportive environment during sleep. Chronic sleep deprivation has been linked to chronic low-grade inflammation. This persistent inflammation is thought to contribute to many chronic diseases, including cardiovascular disease, diabetes, and neurodegenerative conditions. The inflammation isn't intense enough to cause acute symptoms, but is sufficient to damage tissues over time. Adequate sleep helps prevent this harmful inflammatory state. Sleep affects your body's stress response system, which in turn affects immunity. The hypothalamic pituitary adrenal axis, your main stress response system, is regulated partly by sleep. Chronic deprivation dysregulates this system, leading to elevated stress hormones that can suppress immune function. Good sleep helps keep stress hormones in healthy ranges, supporting better immune responses. Your gut microbiome, the community of bacteria in your digestive tract, is influenced by sleep and in turn influences immune function. Sleep deprivation can alter gut bacteria composition, leading to changes in immune signaling. Maintaining healthy sleep patterns supports balanced gut microbiome, which supports balanced immune function. When trying to fight off a cold or flu, getting extra sleep isn't just about comfort. It's actively supporting your immune system's ability to clear infection. Studies in animals show sleep-deprived animals have more difficulty fighting infections and may even have higher mortality rates from infectious diseases. While humans are more resilient, the principle holds. Sleep is medicine for infection. The glymphatic system, which clears waste from your brain during deep sleep, appears to serve multiple functions. Beyond removing metabolic waste, research suggests it may also play a role in immune surveillance, helping remove proteins and cellular debris that could potentially trigger harmful immune responses in the brain. By keeping the brain environment clean, this system could help support brain health, though scientists are still working to fully understand all its functions. Sleep timing matters for immune function too. Your immune system follows circadian rhythms, with different functions peaking at different times of day. Disrupting circadian rhythm through irregular schedules or shift work can desynchronize these rhythms, potentially impairing immune responses. Maintaining consistent sleep-wake times helps keep your immune system functioning optimally. Autoimmune conditions, where the immune system mistakenly attacks the body's own tissues, are often exacerbated by poor sleep. People with conditions like rheumatoid arthritis, lupus, or multiple sclerosis frequently report that sleep quality affects symptom severity. Improving sleep can sometimes help manage symptoms, though it's not a substitute for medical treatment. The common experience of feeling more susceptible to colds when stressed and sleep-deprived is scientifically validated. Studies show people chronically sleeping less than 7 hours nightly are nearly 3 times more likely to develop a cold when exposed to cold viruses compared to those sleeping 8 hours or more. Your sleep habits directly influence infection risk. Supporting your immune system through sleep doesn't require perfect sleep every single night. What matters more is your overall sleep pattern. If you occasionally have a poor night, your immune system can usually compensate. It's chronic ongoing deprivation that causes lasting immune dysfunction. Prioritizing sleep most nights helps maintain robust immune defenses. The wisdom in the advice to get plenty of rest when sick or trying to stay healthy isn't just folk wisdom. It's backed by substantial scientific evidence showing sleep is one of the most powerful tools you have for supporting immune function. Your body does remarkable immune work while you sleep, work that cannot be fully compensated for during waking hours. Sleep is not a luxury or indulgence. It's a biological necessity for immune health, just as essential as the air you breathe and the food you eat. In honoring your need for sleep, you honor your body's remarkable capacity to heal, defend, and restore itself. You've just experienced 100 facts about how your body sleeps, heals, and restores itself through the night. Each of these facts represents not just information, but a testament to the remarkable biological design that keeps you alive and thriving. Your body knows how to sleep. It knows how to cycle through stages. It knows when to release hormones, when to repair tissues, when to consolidate memories, when to activate your immune defenses. All of this happens automatically, without your conscious direction, every single night. You don't have to try to make it happen. You simply have to allow it, to create the conditions that support it, to respect the process rather than fighting against it. Your biology is working for you, not against you. Even in this moment as you rest and let these words wash over you. Sleep is not a challenge to overcome, but a gift to receive. It's your body's way of caring for itself, of preparing you for another day of living, thinking, feeling, and experiencing. In a world that often glorifies busyness and productivity, remember that rest is not weakness. It's wisdom. It's your body's intelligence at work. Thank you for allowing yourself this time to learn, to rest, to simply be. May your sleep be deep, your dreams be peaceful, and your restoration be complete. If you found this helpful, please consider liking this video and subscribing to the Optimal Life Project for more content to support your health and well-being. Sleep well.